Hi, I'm Audra Burns from Dartmouth Health, and welcome to Heads Up, a year-long mental health awareness journey, Dartmouth Health's webinar series which focuses on important mental health topics that affect all of us. We embarked on this journey in May of 2022 during Mental Health Awareness Month, and each month after that, we have examined a different important topic and aspect of mental health, from the impacts of social media campaigns, combating stigma, to public policy, and to shed light on various groups who are impacted by mental illness in different ways, including veterans, teens, and older adults. Today, we conclude the series with a look back at the past year and to take stock and to contemplate what lessons we can carry with us into tomorrow. And I think it's safe to say that we've all learned something along the way. Now, joining me today, we have 4 great panelists who have been instrumental in the success of this Heads Up year-long series. We begin with Dr. Will Torrey, Chair of Psychiatry at Dartmouth Health, and the Raymond Sobel Professor at the Geisel School of Medicine at Dartmouth College. Thank you, Dr. Torrey, for being here.
Thank you for having me.
John Broderick, who we know is the Senior Director of External Affairs for Dartmouth Health and former Chief Justice of the New Hampshire Supreme Court and author of Back Roads and Highways, My Journey to Discovery on Mental Health. Welcome, John.
Great to be here. Thanks, Audra.
We also have Howard Altschiller, Executive Editor of Seacoast Media Group that publishes Portsmouth Herald and Foster's Daily Democrat. Welcome, Howard.
Happy to be here.
And Brendan McQuaid, President and Publisher of the New Hampshire Union Leader. Welcome, Brendan.
Thanks for having me.
Great to have you, all of you here, because we have a very important conversation to wrap up a year's long of a lot of hard work. Now, for those who might be unfamiliar, Heads Up is a series that has been going on for a year, and we have many webinars that we would like you to go back to the Dartmouth Health website. The website is shown on your screen to visit all of our previous episodes. So now let's really talk about the origins of how this all started. And this really truly started with you, John. This is the 4th, I believe, iteration of the Heads Up series. So you've been instrumental since the very beginning, in the very early days of COVID-19 when this truly developed. So tell us sort of how the series developed from there and evolved.
Well, it started, I think, Audra, because Dartmouth Health allowed me to continue my mental health work all around New England, speaking at 350 middle schools and high schools to 100,000 young people. And it so opened my eyes. I'm a layman, so I don't pretend to be a clinician, but I am a good listener. And I've heard stories from too many kids to know that this is an isolated challenge. So it's an everyday, everywhere problem. It affects so many families and people. And Dartmouth Health, which was there from day one, saw an opportunity, I think, to expand it. And then when COVID struck, Heads Up made such sense to get the message out.
And I remember those early days of when we first launched the program. I was actually broadcasting these from a makeshift home office that I had in my 10-year-old son's bedroom because we were all sent home and we wanted to be able to convey this message. And so we all, found a way to do it, which was so crucial at those early stages that you inspired us to be able to share these messages. So now you recently published a book, as I mentioned earlier, talking about your personal journey with mental health, and you've experienced traveling all across New England, speaking to high schoolers about the stigma and truly the importance of seeking help, which is something we've tried to do throughout these webinars, is to empower people to be able to speak up and ask for help. So let's talk about your book and tell us how it came together and what you're hoping readers will take away from what you've wrote.
Well, again, during COVID, I wasn't able to go out and go to schools. And so I said to Dartmouth Health, I've been doing this for 5 years, and it's really impacted me, Audra. I've had more confided conversations with young people about how they're doing than maybe anyone in New England. And so it was inside of me, and I wanted to get it out. And I really wanted parents and grandparents to read it so they could at least see what I've seen and hear what kids have shared with me. And Dartmouth was great, and they said to me, why don't you put that in writing? And I realized at that point, saying you're going to write a book and writing a book, they're not the same thing. But I worked on it for a year, and others helped me edit it. And it's been just enormously rewarding to me. I didn't want that to remain just with me. And I think what I've learned from it is that every family, my own family, so I'm not too righteous about this, every family needs to take a close look without judgment or shame or stigma. And if you see something, or think you might, to talk about it, first with them and maybe with others. I'm a firm believer at this point, after 7 years in writing that book, that we need to start normalizing the discussion, demythologizing mental health problems. It's not shameful, it's not a defect, it's a health issue. And I've also learned from people like Dr. Torrey that evidence-based treatment works. I don't think I realized that for most of my life. I realize it now.
And you've been an incredible advocate and truly helping to break down the stigma. And, we need partners when it comes to this, with being able to share that message. And we were so lucky to be able to partner with the Union Leader Corporation and Seacoast Media Group. This is a very unique partnership that we had and that we were able to bring on board. I think it might have been the first of its kind, where you would take turns publishing articles on different topics and then sharing it within each of your papers. So we really are so supportive and appreciate your support for amplifying the great work that John and Dr. Torrey and all the mental health professionals have done to try and break the stigma, like John said, that we need to do. So let's kind of talk about this process of how it came about. Your writers, and I know you wrote most of it, and your writers from the Union Leader Corporation, really truly insightful and informative and real people came about from these articles, and they were willing to share their story, which I found the most powerful, because when you're at high schools, you would see them all the time sharing with you, and to have them published in these 2 large papers was incredible. So tell us, what was it like working on this project, and what was it like working, for both of you?
I would say, just as John always talks about how little he knew when he started his mental health journey, and as a reporter and editor, I was in the same boat. I understood theoretically that it was a big problem, but I was really starting from scratch. And so working on the first story, I would generally orient myself by talking to John. I'd say, okay, what we're talking about this week is social media and teenagers. And what have you heard as you've been traveling around the high schools? Because that's a great resource to have. Who are the most interesting people that you've spoken to about this topic? Who do you think would have the most to say? And then by the time I was done, by the time this is done, I'll have done 6 of the articles. And in each article, I'll have a stack like this of notes. And then you have to whittle all that down, the best you can to, under 2,000 words. But it really has been quite an education. And then each article is really built on itself. The first time I was calling people, I'd have to explain what we were doing, and we're doing a series of stories, and we'd love to talk to you for it. By the second, third article, I was calling people up and saying, "Oh, I've been following that, and I really, really appreciate what you're doing, and I'm happy to help." So it was easier and easier to get the interviews, and then reaching out to people who don't normally speak to the media, like teenagers, like parents, like community members. You could refer them to the articles we had already done, and they'd say, "Oh, okay, I want to be a part of that." And universally, every person you talk to, as John says often, has a story to tell, has an experience with this, and sometimes it's a frustrating experience, and they want to make a difference, they want to make things better, and that's really how these articles would come about.
What about you, Brendan?
So it was great to work with another paper in the state to share content the way that we did, because John has been such an advocate and brought out this need to get the word out to more people. And so, that was the way we came up with to get the word out to as many people as we could, was that not only, we could do some stories and they could do some stories, we were also going to cross-publish. So we had stories from Seacoast Media on our front page, and I think vice versa, yes, so that a lot more people could see these stories and read about the challenges that the state's facing, which are innumerable, but there are solutions to many of them.
And the solutions happen because people are now reading about it and understanding because of the topics you covered. And can you kind of clarify for our viewers what involvement Dartmouth Health had with the editorial content that you were both writing about?
Yes, so the way this came about was we were approached with, "Hey, John's writing a book and we want more people to know about it." And we said, "That's great, but there's bigger story to that, right? There's a bigger story than just even just the things that John's been talking about. It's bigger than just teen mental health. It's bigger than adolescent mental health. It's from the cradle to the grave, so to speak. Mental health affects all of us. And so we were able to talk with John and with Dartmouth Health, and Dartmouth Health are really, subject matter experts. And the group of us were able to highlight some topics that we said, hey, these are really key areas that we should focus on. And amazingly enough, that list pretty much held us all the way through this entire project. A couple tweaks here and there as we discovered more things, because just as our readers were finding out about this, we were also learning as we went along.
And we also went wherever our reporting took us. I mean, you start here, you start asking questions, and every person you talk to teaches you 3 or 4 more things and suggests more people that you can speak to, and you follow that until you say, now I know what I want to say.
Mm-hmm. And I'm sure there's so many of them that were appreciative that you were giving them a platform to be able to speak on these very challenging subjects, to be able to shine some light on it the way that students do when they talk to you. So we appreciate that platform. And most of our well-viewed videos were tailored to youth. You had mentioned about social media. It was youth mental health that were really kind of the top ones that were discussed. So what did you learn from these stories, and sort of what was the response that you saw from your readers? I'll start with you.
Well, you learn something new with each different story. I mean, maybe the most eye-opening one for me was the piece we did on veterans and veterans healthcare, just because the national dialogue, there's so many platitudes about how we have to do everything for our veterans and be there for our veterans, and they, are willing to make the ultimate sacrifice. And in the end, we ask people to do these incredible things, and then when they're done, we really don't offer the support that they need. And even though everybody in that field is very well intentioned, it always comes down to resources. It comes down to meeting people where they are. Not everybody's going to, get in the car and go to a VA center. But it was interesting to report on all the efforts that were being made. And then I think with veterans particularly, we always think about, that must be caused by going into combat. And the fact is, there's a lot about military culture that I wasn't aware of that even without combat can contribute, because people go into the military often very young, not always from the most stable situations. And they might have developed challenges without ever seeing combat duty. And it was very interesting to talk. And I talked to people who were frontline soldiers, and they talked about the commitment that they had to each other and what it's like to be in battle, and how you just don't want to ask for help. And even though everyone says it's okay, ask for help, the culture is rub some dirt in it and get back into the battle and be with your team. And so yeah, I found that very eye-opening.
Yeah. What about you, Brendan?
So there were a lot of great stories that we covered. I think for me, reading about all the various folks that are affected, and one of them was the elderly. We had a story on the elderly being affected by mental health, and it's sort of a group that you don't necessarily think of, but the lifestyle of a lot of retirees being removed from society really changes their aspect on mental health. And you asked about, reaction. We talked about the problems that can be solved, and sometimes that problem is big problems. Like our most recent story, we talked to Dr. Torrey, actually, our reporter, Roberta Baker, talked to him about all the sort of missing pieces in the healthcare system and how they're having to do more and more. But they're having to do more because more people are aware of mental health and what's going on with that. So, the reaction I think we got was, there's big problems that can be solved, but sometimes the solution is just an individual's solution, realizing that they can get help for this issue that they've been having. And hopefully our reporting was a window in that for a lot of folks.
And I'll turn to the two of you, because John, these topics were, inspired by chapters in your book, and Will, you're living it, daily with what you're seeing and hearing. So was there a particular segment or topic that you were really happy that we covered in this that you think was really important? And John?
Well, I've been spending my 7 years mostly with young people. And what I wanted people to know, this generation, I love these kids. They're really smart. I love them. And less judgmental than any prior generation. But if you look at the numbers, this generation is really suffering from excessive anxiety and depression. And so they want to talk about it. I want people to know that. I was at a school within the last 2 hours in Vermont, and kids were coming up as young as the 9th grade, opening up to me. I'm a stranger, but maybe that's why I'm safe. What I want people to understand is that the mental health world needs their support. It needs a system of support. It needs reimbursement that makes sense. It needs more providers who we pay appropriately. Because what I'm seeing with all these kids is that help matters. I mean, it's not consigned to someone for the rest of their life. Treatment works. But unless and until, Audra, we're willing to finally say more publicly, my mother, my father, my brother, my cousin, myself, we're never going to change it. And so I've been so impatient. I've focused on kids, but as Brendan said, it's not just kids. It's all ages. It's cradle to grave. But until we normalize it, take away that shame, that stigma, we're never going to provide enough space for people like Dr. Torrey, enough people like him. We're not going to value in the way we should those services, which there are tens of millions of Americans, tens of millions, who have a diagnosable mental health problem, and evidence-based practices and treatment work. But if you don't get them, they don't work. That's what I've been talking about, especially with kids.
Yep. And I know you've said before, 1 in 5 is the statistic, but is there—
in any given year.
In any given year.
Yeah.
So is there any topic that we covered that you were really happy to see because you've already experienced that that it's something really important that we should be promoting?
And overall, I was just really grateful for your diving into this topic because, I've been engaged in providing psychiatric care, mental health and addiction care in New Hampshire since 1985 when I came as a resident. And for much of that time, we were just sort of talking on our own without being able to get a broader societal attention. And clearly, this is an issue that when you live at all, any length of time, you see that if it's not you, it's someone you love who lives with a mental health or substance use disorder. So it touches all of our lives. And so I actually was touched by many of the articles and many of the webinars. I was particularly moved, like you were, on the veterans one. I thought that the veterans in the webinar who, spoke about their own experience seeking care and getting help from care was a wonderful invitation and just very human and straightforward. So I found that to be a particularly useful one.
Mm-hmm. And you're so ingrained in the mental health field. So, moving forward, we're transitioning away from the partnership, but how would you, kind of talk to healthcare providers or journalists about what can they be doing or what should they be thinking about to help combat the stigma?
Well, I think these conversations are quite helpful. The more people talk about their own experience, their experience themselves with mental health difficulties, seeking help, their experience with family members who've gotten good help. It's those stories and just talking to each other. I remember just being in the room with, college friends and talking about what I do, and then having people come up individually and talking about their own, story. But I look forward to, and I think it's happening more and more, that the whole group will talk about their experiences with each other and just be more open about it. I think that invitation, no one signs up to have any kind of illness, and certainly no one signs up to have a mental health or substance use difficulty because it's not fun. And as John's been emphasizing, people do respond to good treatment, and we need to make treatment extremely accessible. I think that the broader conversation, gets more and more people involved. And I think that's what we really need. It's a culture change. It's going to take all of us. It's going to take the people providing care. It's going to take people advocating for in their insurance companies, in advocating with their employers, advocating with their with the legislature to just build out support so that we take these issues with the same seriousness and of purpose as we've taken cancer or other major health concerns.
Yeah. And how can we go about, as we move on and move forward, and you're going to continue to have people, like you said, who want to share their stories and want to talk. How has this experience, informed you as journalists of how you're going to continue talking about mental health?
Well, I know I already have a story list going of things that we haven't even had a chance to get to yet. I think eating disorders, I have seen a lot of that. I've seen a lot of families grappling with that and how difficult it is, and how difficult it is to get to the care. And also, the analogy is always, it's not like a broken bone where you go and you get your bone set and it heals. It can go on for years and years and years. And so I think that is definitely something. I'd love to take a deeper dive into PTSD. We talked about it in the veteran story, but I think that's a big topic worthy of a deeper dive. And then I want to write about the history, kind of how did we get here? How did we treat mental illness? Where are we now and where are we going? But I think it would be interesting to step back 100 years or so and say, how did we get to this point?
The reminder for me is always mental health care is healthcare, right? It permeates everything that goes on with everyone's healthcare in general. And just like mental health itself, there's no end to this story, topic and coverage, that it's going to continue to permeate our society for as long as we're a society. So we have to remember that as journalists, that every story might have an aspect that deals with mental health. It comes up a lot in crime stories and other stories that we cover for other reasons. And it's just the reminder that mental health plays a role in all of that.
And speaking of stories, you inspired all of this. So I'll end with you, John. What have you learned from this, and what's next for you?
Well, you want to know something? I just want to thank Dr. Torrey, who returns my calls pretty regularly. I want to thank Howard and Brendan. What you've done is amazing. I mean that. I'm grateful beyond measure for it. What Dartmouth Health has done made a lot of this possible. I can remember my mother years ago whispering the word cancer. I can remember the reaction to people with HIV/AIDS in the early 80s, which wasn't positive. And now I see what's happened with breast cancer, with HIV/AIDS. And sadly, because of COVID, there are no silver linings there, but with respect to mental health, COVID has revealed mental health problems in a way that nothing else has. And so that's a good thing. But I agree with Brendan and Howard. It's an ongoing story. Breast cancer didn't get treated successfully in 1960. Very different today. It's an ongoing effort. And, my encouragement is that we keep the ball moving. It affects so many families. And my hope is that we will develop a mental health system in the United States. We do not have one. We have some great and talented people in mental health. We don't have a mental health system in America. And it used to be that way for breast cancer. It was that way for HIV. That's come a long way. We need to keep the discussion going. And if it's not in a formal way, as this has been, I have confidence that Brendan and Howard Altschiller really have internalized this message, see it in a way that maybe they didn't, like I didn't either at one point. It's pretty hard to put it aside. And I don't think they will. And I think there are people in the state that are willing now to speak up. I hope so.
Yes, and you've certainly helped inspire all of that. So, John, thank you so much. Dr. Torrey, thank you for you and your team's incredible work. And Howard and Brendan, thank you so much for your incredible platform to be able to help share these important messages. One thing that came out of this is that we do have incredible resources from every single webinar that we tape. So I encourage our viewers, if you go on to the Dartmouth Health website, you can go and see a collection of all of the mental health resources that are available. Stay healthy and stay safe. Take care.